Yeah, you cannot do anything about it. Yeah.
The person of hypertension is a signal given earlier that he is heading towards a heart attack.
Sir, hypertension is one of the risk factors for heart disease. And all
Nobody knows the cause of hypertension disease. Nobody knows.
we know the cause of hypertension now.
They have mentioned that nobody knows the
Who?
cause of risk factor. What I understand.
No, hypertension. We know the cause of hypertension very much.
What is that?
Yeah, that's what I will explain you. I'll explain you. I'm going to. Let me talk. Even primary hypertension, we know the cause. That's what I'm telling you. Let me talk.
Okay.
Yeah. There are two types of hypertension, primary and secondary. Secondary is because of something like some endocrine problem or renal artery problem or whatever that can be cured with surgery. That is also called surgical hypertension. There is something called medical hypertension. It is caused by lifestyle, abnormal lifestyle. It could be lack of exercise, it could be wrong approach to the events around you, or a wrong diet. So if you correct your lifestyle, it will be taken care of.
Which one is
Essential or medical hypertension. Yeah.
and hereditary aspect? What can you do?
Hereditary, everybody is prone for this disease. So that whatever hereditary people talk of is again commerce, not science.
Mental stress will come in or
It is a biggest factor. Mental stress is the biggest factor for hypertension, diabetes, coronary disease, everything.
for that only the patient himself can act.
Yes. That's why I told you. Bypass surgery or angioplasty is not the definitive treatment of heart disease. It is the lifestyle management that is the treatment of heart disease. Out of 100 patients coming to me with blocks in the arteries, 50% of them go back with advice about lifestyle management, reversion of heart disease. Only 50% need angioplasty or bypass surgery, mostly bypass surgery.
Doctor, what is that ideal lifestyle that should prevent heart disease?
Yeah, I'll come to that. Yeah.
Sir, only one question, sir. To save the heart muscles, only this injection works or other medicine can be given within 6 hours?
Pardon?
To save the heart within 6 hours, save the muscles of the heart within 6 hours, only this injection works or other medicine can be also work?
No, this medicine will break the clot.
No, I'm not suppose that medicine is not given. Is there no other medicine which can be given in place of this?
Usually I ask the patients to wait till 3 months because till 6 weeks there is a high risk of but to be on safer side I ask them to wait for 3 months and do the intervention. Swelling, yeah. So to prevent heart disease, this is what you have to do.
Sugar can affect the heart.
Yes, it can.
What's the reason?
What do you mean by high sugar?
Diabetes.
Diabetes.
I'm talking about diabetes.
What does patient get in diabetes? What is happening inside human body?
Insulin levels are
Okay. Leave aside insulin. You are asking me about sugar.
yeah.
So what is happening to sugar?
It's energy.
What happens to sugar in a? No. What happens? You said high sugar causing heart disease. What exactly is happening there?
Yeah.
I am asking you. What is your concept?
It's not being utilized by the body.
Yes, it is not being utilized.
It is being deposited.
It is not deposited.
Getting converted to fat.
No, what happens, I'll tell you. There is a road, there is some house here or room here or some factory here, some work is going on over here. There is another workshop where the factory is there, work is going on. Now sugar is passing through the street, and sugar is the fuel. If sugar does not come inside, that is the fuel does not come inside, the factory will not be, the machines will not run. Yeah, so that is what exactly happens. There is a lot of sugar in the blood, but there is no sugar going into the cells. So cell machinery collapses. As cell machinery collapses, heart is also having cells. Its machinery also collapses.
The body is not eating the sugars rightly.
Pardon?
The body is not eating the sugars in the right way of the right way.
Yeah.
Sir, what is E0Q10?
Pardon?
E0Q10.
Coenzyme 10.
E0Q10.
Coenzyme 10.
No, what do you want about?
You spell out or you enlighten on that. What is that?
No, my knowledge about it is not complete, so I cannot. No. Yeah, no, my knowledge is not complete about it, so I don't want to give you wrong picture, or wrong information. Yeah.
All the doctors say, the internet says, they have to be very specific.
Yeah. Sir, why don't you come here?
Alcohol, about alcohol, it is said that it is a stimulant, but provided you don't have an excess.
Yeah, please have a seat.
You have to control your mind. If you have 30 ml or 30 ml, it's a stimulant for the heart. This is said by the best doctors in the best books. I've gone to the internet. And avoid tobacco is out of the question, but about alcohol, let me be very specific. It should not exceed 60 ml per day.
Okay,
very few people in the world have to control. It requires your mind. Because, see, I'm a Parsi, and so I don't know whether you're in touch with Parsis. Parsis have a very, very happy life. They eat very, very happy, enjoy, drink, eat merry.
Everybody do it.
No. And yet,
That is in your blood.
and yet Parsis have a very long life. The research was taken, that was because of the attitude and not because of alcohol or mutton or fish.
Yeah.
So it is different for everybody. So I want to ask you about the question, why are you so much against a small quantity of very good quality alcohol? I am not saying there's some alcohol, rasta ke mal. No, good quality.
I'll explain to you. Please. Yeah. I'll explain. Yeah. First of all, alcohol is bad. That you should understand. Alcohol causes so many problems. Now, that misconception about alcohol, it is a misconception. A paper was published. Wine in certain dose is good for heart. Later on, because this was a great news, because if a man bites a dog, it becomes a news. So till now alcohol was called bad, and suddenly some professor was saying that alcohol is good. There was a research paper in a reputed journal. Then it was found that nobody published. That doctor had a stake in the winery and his license to practice was cancelled. The one who published that particular thing. But that has propagated the wrong concept, because that paper is there still in the journal, that nobody has taken away. Then it was put in wrong way, that was projected in the wrong way. Actually, there are some phytochemicals present in the red wine, not in the alcohol, in the red wine in particular. And from where do they come? They come from the skin of the grapes. Then why not to eat grapes? Why to have wine? Which you cannot control. I mean, if you don't control, it's a problem.
Yeah.
So even if you eat 2 kgs of grape, it is all right. So why not to eat grapes? And why grapes? Why not carrots? Carrots also have phytochemicals. Beetroot also has phytochemicals. All red and orange fruits and vegetables have phytochemicals. Then why to go for wine? That is the thing. Alcohol causes alcoholic cardiomyopathy, damages the heart. Now there is individual variation.